Okay. Hi, HHN friends. This is so exciting. We've kind of been working so hard, really the last couple of years, to get to the point where we are ready to submit our national impact study. So we have a bunch of people to thank because it certainly took a lot of our efforts from our pilot committee and then our new friends and partners over at Oklahoma State University. I'll be just so proud to tell you about them as we get a little further in the presentation. Just to give you a format, I want to give you an update on where we are, and we're going to talk about the impact study and how to implement that. At the very end, I will show you this study. I will show you the questions and how it looks to fill it out online, and the paper option as well will be available when we are ready to kick this off. So just know that, and then I'll take some questions and answers at the end, as I'm sure you'll probably have some. So why is it important that we do an impact study? One, we all want to be able to measure the effectiveness of our programs, not just nationally and the impact we make, but also your individual houses. And the numbers and the stats and the data, the outcomes that you're going to be able to present to your donors is going to be, I believe, life-changing for you, but I think mission-changing for a lot of our houses. So, you're going to be able to identify the activities that you want to continue with. What programs are you doing that are making a difference? Or, are you seeing something back in the data that causes you to kind of pause and think, maybe we should do this differently? I think that when you put this before the funders, you're going to see just some very positive reactions to know that you care enough about your mission to measure it at this level. And I think you'll find that because of this study that you're going to present to your funders, you're going to be head and shoulders above other nonprofits that are not able to do this as clearly and as readily as you guys are going to be able to. And then your insiders, your board members, your staff and volunteers, it's important that they know how important your programs and services are and the impact that you're making and that they're individually investing in. So I think there's a lot of audiences that will be interested in this survey results for you. So if you're presently a member, if you're a current member of the Healthcare Hospitality Network and you want to participate, meaning that you're going to send out a survey to your guest population, then when that data gets collected and brought back and reported, it's free for you. As long as you're a participating member in the survey, then the results, the reports are free to you. You'll get 2 reports back. You'll get the national collective report back so you can see collectively how we all answered those questions, or the survey answered those questions for all of our programs. And then you'll get your individual report by your house. And you can see how your data matches up with the national results. So you actually kind of get a 2 for the price of 1, I guess, on the free thing. If you're a member house and you can't participate or you don't want to participate in the survey, guess what? You still can have access to the national data that comes back. It is at a cost of $200. Which is a minimal investment, of course. The difference is you only get the national data back. You don't get your individual house data for your individual community to see your results, but you will still have really great information to talk about with your funders. And then for non-members, people that are not members of HHN, but they do want the survey, the national survey, then it's at a cost of $700, which is still a great investment, because I will tell you, when Tulsa started implementing our outcome measurement study, and we started this 10 years ago, actually, is when we started this. And the year after our second time we did it, we started getting in front of funders, and our grants went from $15,000 and $20,000 in range up to $50,000, $60,000, and $100,000 in range, because they had been asking for outcomes, and we were able to jump on that early and get that to them in the formats that they were looking for. So even if you're not participating, you're not a member, it's still a great investment. I would just want to encourage everybody who can and is able to do a survey with their guest population. It will only help us really communicate effectively across the nation, as well as in the individual houses, the great work that you're doing. So how many questions? We've got 45 questions in the survey, and I know that sounds like a lot of questions, and it is a lot of questions, but we've estimated in practicing and taking the surveys, as we've put it in front of different people, it's taking about 10 to 15 minutes to complete a survey, and that's not a bad investment. You'll be able to distribute to your guest population the surveys either electronically or as a hard copy on paper, and each individual house will determine which format they would like to use. And I think we cover it in a little bit, but I would encourage you to think about dividing or just running reports out of your database on the age population of your guest. And if the majority of your guests are 60 years and older, they're going to reply to a paper survey much easier than somebody who's younger. A younger guest population is probably going to respond, and I say probably going to respond to a electronic survey link that you send them. In the pilot houses that we did, we had houses that actually went into their database and they segregated out those guests that they were surveying by age, and the ones that were over the age that they picked, they actually sent a hard copy paper to, but the ones that were younger, they sent the electronic link. So it's totally your call on this, but we want to get back as much data that we can from your guest population, because that does enhance the quality of your survey. So the first thing is getting that database ready for your guest. This is not about statistics, but it is about knowing that you've got correct email addresses, correct mailing addresses in your database, so that when you get ready to send these surveys out, you're not stumbling upon returned mail or returned emails bounce back. And we talked about how to implement, whether electronically, email or text, or with the physical hard copy in the mail. Couple of things to consider when deciding whether you want to is, of course, the higher rate of return. If your guests are younger than 60, would be the electronic way to go. It does take less staff time electronically. The data collection is easily and it's automatically input into the database, and there's no cost to print or mail a survey. And everybody's like, yeah, sign me up for that one. And that's great. However, I just want to encourage you, really look at the age of population of your guest, because you can do the work and send the links out, but if, let's say you're sending out to 300 guests, if you only get back 5 returned electronic surveys, then you really haven't surveyed your population. You really should strive to get, somewhere around at least 10% response rate in who you send back, who sends back their surveys to you. I will tell you, in Tulsa, we have been doing it by paper for these 10 years. And I know that sounds so antiquated, but the average age of my guest is over 60. And I get back 28% of my surveys. So that tells me what I need to do based on my demographics in my database. And I know what that data means to my funders. So that's my decision. If you decide to go hard copy like we did, then that's kind of your criteria on that. And I think you'll be fine. So how much is it going to cost if you do a paper survey? We're actually going to send you a cost estimator if you're going to take into consideration doing a hard copy. And that will include, you know, the number of pages that it takes to print, so you'll have the paper cost on there. If you're printing in-house, you probably have, you know, a calculation of what it costs you to make a black and white copy on the copier. If you're sending it out to have it printed, there's going to be a cost to that. I would recommend, if you do want to go paper and you cannot print it in-house, that you seek a partner, either with the church or a corporation or one of your board members that would underwrite the cost of the printing of your surveys, and that would be helpful. You'll also have the cost of envelopes, so the mailing envelope and the return envelope, and then of course the postage. And with the volume that you're going to be doing, you should seriously look at doing a bulk mail rate with this, so you can get it mailed out cheaper than 50 cents on those stamps. The really good news I have to share with you too is those that are doing a hard copy paper survey, one of the responses we got back from our pilot group that practiced this with us was, you know, we can send out the survey, but when those surveys come back in, we don't have the staff and volunteer time to input the data into the database. We have answered that for you through our friends at Oklahoma State University. We have 2 PhD professors, one from the Oklahoma State University Center of Rural Health, and one PhD professor from the Oklahoma State University College of Hospitality and Tourism. And so they are engaging their student body in our outcomes, and they're going to actually input all of the paper copies into the database for us. So we have completely taken off the labor-intensive part of your data. Because the OSU students are going to input the data, we're going to have you mail or have the surveys mailed to Philos Hospitality here in Tulsa, and I will collect all of the paper surveys that come in, and I will deliver them to Oklahoma State University professors, and they will distribute out to their classes and their students that are helping us with this. And that way we don't have to, you don't have to worry about trying to get it to me another, you know, with another way of postage or mailing. It'll just all come to our post office box, and my staff knows to watch for those, and we will collect them all and get them delivered. By the way, you'll see at the end of the slideshow the 2 professors, the PhD professors that are helping us. One is Dr. Dina Wheeler with the Oklahoma State University Center for Rural Health, and she was so excited to be able to do this because she works with all of the issues and the patient population that we deal with and find no answers for. And so she felt like her work that she's doing as a grant writer and a researcher in that particular field, it's going to just give her a lot more information to be able to share with the problems that they're trying to solve through the Center of Rural Health. And then Dr. Catherine Curtis at Oklahoma State University College of Hospitality and Tourism was so excited to join us as well, because when she was in school in Florida, she actually worked with the Hubbard House on a research project at the university there in Florida. So when she saw this opportunity, she just jumped on it and said she definitely wanted to help because she had such a fond memory and experience working with one of our hospitality houses there in Florida. So it feels like we've got really great support from our academic professors, and I'm very excited about that. Okay, so your final report, what will you get by participating? What will that look like? You're going to get a lot of data back, and it's going to be crunched up, kind of like Excel data, and we're actually going to be able to present, because the university students are going to break it down for us and give it to us in really good formatted data, both locally for your house and collectively for the national impact study. But we want to encourage you guys to, when you get your data back, to really try to communicate that data concisely for your donors or your funders or your board. And I'll show you an example of how we're doing that in Tulsa with our expansion campaign. But just kind of give you a snapshot of what that could look like. So the more graphics and visuals you can present that data in, the better off it'll be. You can see our thank yous here for Dr. Dina Wheeler and Dr. Catherine Curtis. And I also want to point out a big thank you to our pilot committee. Last year when we entered into this, these people came alongside us and said, we want to help by doing a test survey out to our guest population, and we want to see what data we've got coming in. And what that did is really helped frame and test out the questions that we had. And I'm so happy and proud of this group, because when I brought the results and I brought the questionnaire to the academic professors that do this all the time with surveys and research, they were so impressed that HHN had worked so hard on this and prepping it for them. We had very few changes to make in the final survey product that you'll see. Probably 90% of what the work we had already done didn't even get touched. It was really just a few things and Q&A and phrasing, and we dropped a few questions and rephrased a few questions. And so I just want to thank the pilot group, because without your work, we could not have gotten it done as quickly as we did. And of course, in this stage of research, it's pretty important. One thing too, I'm pretty proud of that this group and our professors at OSU were able to help us get done is this will be an IRB approved study. And you may not know what that is, but it's the international group that reviews and approves surveys that go out to public bodies for scientific and journal research. So once we have the IRB approval back, and we should have that back within the next couple of weeks, once we have that back, we will be able to send out the survey, and then on the results, we'll be able to write papers and write reports and submit those to medical journals and the media and all kinds of publications that would then look at this research as substantial in the areas of healthcare and hospitality within healthcare. So I'm excited for us to get to that stage, but before we get to that stage, we've got to get the data. So what I want to do right now, if I can get to my meetings here, is I want to show you, and I hope I can find it. I'm going to show you a file. There we go. I'm bad at driving. Here we go. I'm really bad at driving. This is the result of what Tulsa has been doing with our outcome measurements or our impact. And so we're kind of encapsulating both our statistics and our data from outcomes on a front and back page that we can hand to donors or funders or interested parties so that they can kind of get to know what that is. But this is just an example of one of the questions that would be reflected in the survey. So how far did the caregiver or patient travel from home to receive medical care at your facility? You can see how it breaks that down. What medical diagnosis brought the family to Tulsa or to your community, and it kind of breaks that down in a wheel form. Where did the family stay before checking into Hospitality House? You can kind of see the data there. So when you present it in a more of a graphic form, it's I think able, the reader, the donor is able to take that data in a little bit more quickly and understand it. And then I want to walk you through the actual questions. I'm going to get there maybe. Here we go. Okay. So this is the preview of the survey. And if you were going to send an electronic copy to a guest, this is what this would look like. And if you're going to send a paper copy, it's going to look very similar, but it will be formatted on paper that's easier to read and all of that. The email and the paper copies both will have a cover letter or a cover email describing what the survey is and asking the families or the recipient to participate and why it's important for them to participate. And it's the survey cover letter itself also goes through the IRB approval process to make sure that we're not enticing or paying or bribing or whatever it is people to take it because they're going to get, you know, something substantial out of it. So really it's based on their ability to help other families is how the letter is phrased. So it tells them how long exactly it would take them. Now this is where I was like, how are we going to know it's for my house? Well, the recipient's going to click the state that they stayed in, which medical hospitality house that they stayed in, and they'll go down and pick the state. And then once they pick the state, then the member houses in that state will appear on their screen, and then they'll pick the house that they stayed in, and then they'll move on to the survey. Now, once they get to the survey, the first thing it's going to ask them is, are you the patient or the caregiver for this stay? And the reason why you ask this question is because it takes you on a path of questions that's directed towards a patient, or it takes you on a path of questions that's directed for the caregiver. They're all very similar, but they're written either in patient-directed or caregiver-directed language. Describe the primary reason for the patient's medical treatment of your most recent stay at the hospitality house, and you'll see a list of different diagnosis groups. Now, we didn't make these up out of thin air. We actually went to the CMS, which is the center of, it's the national group that oversees Medicare and Medicaid, and they have a journal book that they break down the primary diagnosis by, and that's what we went off of. During the time you were staying in our medical hospitality house, what was the zip code of your permanent residence? So this kind of question gets them to the distance between their house and your hospitality house. And then describe your permanent housing situation, and we give options in that language. What type of health insurance did the patient have during hospitalization? Again, we went to CMS, Medicare, Medicaid, to get how they break down the major insurance examples there. And then what was the name of your patient's insurance provider? This is open text. This is so we can start gathering data as to, when we look nationally or locally, is there a major insurance carrier that we serve a lot of patients from? And if so, that should be a great partner for HHN, or locally, that should be a great partner for you. Did the patient purchase insurance through Marketplace Exchange provided by the Affordable Care Act, also known as Obamacare? Yes and no. This speaks to any political or government agency or government policy that legislative bodies are thinking about. So we want to make sure we had something in there that would help them with any decisions that they're making. And then including yourself, describe the number of individuals in your household that were supported by your income. So this is all about the financial impact during your stay at the hospitality house. What was the dollar amount you're responsible to pay after insurance, additional non-medical expenses. If the medical hospitality house decreased your out-of-pocket expenses, then rank what was most important that you were able to spend your money on. This is important too with policymakers and insurance companies and lots of bodies of interest there. Did the savings you experienced staying at our medical hospitality house versus paying for a hotel motel apartment help you avoid a foreclosure or eviction from your permanent home? That's another important indicator of the tie between homelessness and healthcare crisis. How many total days did you miss work due to the medical accident or medical crisis? And then please select the primary decision to stay at the hospitality house. So was it cost? Was it close proximity to the patient hospital treatment center or other? And then they can write that in. Was the patient's hospitalization treatment a planned appointment? So some of you guys, do a great job with reservations. Some of us are just out here with a waiting list, and we want to know kind of where these patients are able to plan their treatment or not. How many of them are coming like in an ER situation? During the patient's hospitalization, where were you primarily sleeping before you checked into the medical hospitality house? And so we've listed options there, and they have room to write something in, referring to where you were sleeping before you checked in, how many hours of sleep were you getting after you checked in. So there's lots of befores, durings, and afters, not just on sleep, but also on meals and level of anxiety or worry. Physical health is all part of that measurement. Were there any services that were important to you that were not provided? And we gave them some options, so they can also write in options. Which of these additional services, if not already available during your stay, would have been helpful again? And then thinking about the services, rest and quality, and meals and distance to the treatment center, what impact did the medical hospitality house have on your stress level? Thinking about the services, rest, and meals, what impact to your stay had on your physical health of the patient? And how do you think the patient's health was affected by you staying at the hospital? This is the caregiver. How do you think the patient's health was affected by you staying at the medical hospitality house? Now you see that's an open text field where they could write anything in. So part of the students' work at OSU that they're going to be helping us with is when they get this open field data back, then they go through and they create the different categories that they're seeing and how those answers fit into those different categories. So we'll be able to measure that, not based on just the individual text that they're sending, but what's the message they're sending us through that text. How would you rate your physical health upon checking out, and level anxiety upon checking out, all those things we talked about before? And then what were your biggest challenges or needs in your health crisis situation once you returned home? So, we do a great job serving them while they're with us, but what happens after they get home, and how does that speak to what we do or what we don't do for them? After the patient was discharged from the hospital or the outpatient treatment, did the patient have an unplanned readmission within 30 days to any hospital for complications from the same diagnosis? This is a huge question in healthcare right now, and that's the 30-day readmission rate. And this is, how do hospitality houses impact or improve the 30-day readmission rate? If we can answer that question, that's the $1 million check right there. And then at the end, we're going to ask some more demographic questions, such as, is the patient a veteran or active U.S. military member? And we'd want to know that. And what branch of the military, gender, age of the patient, highest level of education, employment status, household income. And then the final question, how hard or easy was the survey to take for you? So that's the survey, and that will all go right into the database. I guess at this time I'd like to kind of open it up for questions. And Brittany, I'm going to let you control, or Joan, let you guys control how we want to do that. You may have gotten some questions in online, I'm not sure.
Yeah, so you guys can feel free to use the chat box if you'd like to ask a question that way, or you can unmute your line and ask it out loud. So use either one, and I will watch the chat box for you, Tony, in case we get anything here.
Thank you.
So we got a question. I assume the questions from the patient perspective are similar enough that we don't need to see them. Oh, in terms of, we previewed the caregiver survey, but the differences between the two.
Oh, you want to go back and see the patient? Let me see if I can get back there. No, I can't. Hang on.
I don't think that the language is too different. The total amount of questions remain basically the same. We
It
really
is.
just changed the wording so that it was clear, who was being talked to. You might have to hit that link initially from the email that I sent you, Tony.
Yeah.
Oh, there we go. Nope, you got it.
Okay. So I'll select the state. I'll select the house. And I'll select patient. Again, describe the primary reason for your medical treatment. Again, same kind of questions. What type of insurance? It's really just speaking to the patient directly. Again, the financial questions are very similar there. Really no change. How many days of work did you miss? And so really what you need to understand the difference between patient and caregiver. The questions are similar. They're posed as the patient, of course we're talking to the patient, but we'll be able to separate out with the data. We're going to take all the answers that caregivers gave and formulate the reports based on the caregiver responses. And then we'll take all the patient categorization and format the results based on what the patient is saying. Now, I think maybe what you're asking is, those of you who are surveying your guest and you're keeping outpatients in your house and you're keeping their primary caregiver, I think the question is, are you going to survey both of them? And I think from the pilot committee, what we came back with is we think you should just survey one or the other, either patient or the caregiver. But I'm going to leave that up to you if you want to send out two different surveys. One is the caregiver, one is the patient. But I think we were all in consensus that just surveying one member of that household was sufficient.
Right. So we got some more questions coming in, Tony. So Janice asks, how many pages is the hard copy survey now? And for those of us sending out the hard copy, it would be helpful to identify at the top of the survey which is caregiver and which is patient, and can this be done? And we'll definitely make sure to indicate, what type of survey it is. And Tony, do you want to answer a question of where we're at in terms of the printing?
Yeah, the number of pages. I will tell you with the cover letter, it's probably going to be 9 or 10. We don't have our final formatting on the paper done because the IRB approval will come back. And if it has any suggestions of changes that we need to make, then it could mess up the formatting on that. But the one in Tulsa that we send out with the cover letter is 8 pages, front and back. No.
And I think
I'm sorry. It's 4 pieces of paper. 8 pages, but it's front and back, so it's on 4 pieces of paper.
And we're definitely going to be very cognizant of printing costs, so we're going to try to format it in a way that's easy to read, but also really streamlined to make sure that it's clear who it's for and it's really easy to take. Yeah. There won't be any weird spacing that we had in our first draft during the pilot program that I know Janice saw that first draft of it. Back when we did that.
Yeah, and we recognize that we're surveying an elderly population, so the font and the size of the font has to be important as well.
Right. Let's see if I missed one here. Okay. Kathy says, are you going to suggest that the survey goes to families that stayed with us 6 weeks ago or 12 weeks ago or something like that to have the cleanest data possible?
I'm going to talk about this one more time with our professors. Originally, when we formatted this survey, we really wanted you to take your 2018 guest population so that we could all be on the same point of time with our guest. When we get the IRB study back, I will ask them if we want to move that date to 12 months from June 1st or something like that, so that we're all kind of on the same timeline. And that's important. The timeline is important too. And let me just say this, once you send it out to that time frame that we're suggesting, once that group has been surveyed, if you want to keep doing the survey just for your house after we've kind of closed this down, so you can keep getting current data, you absolutely can do that. The link is yours to do that. Now, the OSU students won't be putting your paper copies in for you, but the link would still be available for you to use. Am I correct on that, Brittany?
Well, I will just say the caveat is once we move out of our time frame and we're no longer accepting those applications, it will be the same survey, but it will be a different link so that we're not cross-contaminating the data where it's going into. So it will be a different link, but the survey content itself will be the same and available. I know what a lot of people are planning on doing if they're doing it electronically is they're just going to take the data and then on the back end, if they use SurveyMonkey or if they use another type of survey program, they can just take those questions and then put it into whatever program you use moving forward. But in terms of the hard work of actually structuring the questions and whatnot, you'll be able to use those questions kind of moving forward. So you're asking the same thing.
Yeah.
Christine asks, can you remind us the date time frames of the survey?
Okay. So right now, as I'm speaking today, and that's without the IRB final approval yet, but right now our plan is that you would take your, I think she's asking what guest population date. It would be January 1st of 2018 through December 31st of 2018. Did I understand that question correctly, Brittany?
I think so. Christine, are you asking in terms of who are we going to be surveying, or are you asking in terms of when we're actually going to start launching the survey, when that link will be live? I didn't see real clarity in that question, but yeah, I think okay, and also when the survey will be live and launched.
Okay, great. So we should get back the IRB approval any day, and my goal is that we could start launching the survey as early as July 1st. But you probably have some work to do before we get to that July 1st. So let me just encourage you to work on your database, check your emails, make sure you don't have any, if you've got bounce back emails, start calling or contacting your families to see if you can get a current email address from them. If when sending your newsletters out, if you're getting return mail from guests, you want to go ahead and make sure that you've updated those addresses and you've got current mailing addresses that are good. You want to probably go into your database and divide out your population to know what your age of patient or age of caregiver is that you're going to be surveying, and figure out if you're going to do electronic or if you're going to do paper or if you're going to do a hybrid model, which is segmenting your database and finding those and putting them on a list if they're under 60, and finding those and putting them on a different list if they're over than 60. And if you're going to do partial paper or you're going to do all paper, you want to figure out your cost and get your printing partners established, and figuring out your bulk rate situation if you've not already got that done. Figuring out how many surveys you're going to mail. That's lots of work to do in terms of getting ready to survey.
Janice asks, so our response address for the hard copy should be the Hospitality House Tulsa address. Are you going to provide the cover letter as well?
The cover letter, yes, is formatted for you. However, you will need to personalize or customize, I should say, customize that cover letter with your name, your house name, your house logo, and your signatures at the bottom. And on the signatures, I would really encourage you to have 2 signatures on that letter. One being one of the staff members that you think the families most encountered while they were there, so they would recognize the name on the letter. And the other signature maybe being the executive director or CEO or even the board chair if you don't have those positions. But I would encourage one of those names to be a name that's familiar to the families who stayed with you.
Yeah, so we'll definitely be providing that cover letter template, which people can kind of adapt to fit your house. Yeah. That'll be something you can use in emails when you're sending it out digitally, and then also can be obviously printed. And the only reason why those aren't available at this time is because they're also a part of the IRB approval, so they're under review before we can make sure that we're on target with those. And then Kathy asks, Assuming the survey opens July 1st and the majority of houses are using hard copies, have you determined a deadline date, such as 30 days, 60 days, for the hard copies to come back to Tony?
Yeah. So I think based on what I'm hearing from the professors at Oklahoma State University, they think that the students can probably start inputting the data late August. So I think the professors are probably going to give us a close date. It could be early September when we stop receiving paper surveys. Just as a reference point, in Tulsa, when we do the survey on paper, we got back the second time we did it, we sent it out, and we did 3 years of guessed collectively is what we sent out. We got 30% return rate on that one, and it was I think it was 17 weeks, if I'm not mistaken, that it took to get that back. So the professors felt like if we could get this kicked off July 1st and we close it mid to late September, that should be a pretty good time frame to get the first initial data back. And when I talk to them this week, if that changes, I'll certainly let you know.
And when that deadline is, we'll also have it on the electronic one, so when people see the link when it goes out, they'll see kind of we need your results by, so everybody will be on that same timeline. And then Kathy asks, if the IRB approval is denied, will HHN still move forward?
Yes, we will. And I'm going to tell you I'll just tell you based on my conversations with the two professors, based on the survey work that we've done, they couldn't find any reason why it would be declined at all. And it's usually a quick turnaround. So we're expecting that it will be. What they will is they'll send back edits for us. If they're not going to approve it, they'll tell us why they will not approve it, and they will suggest what we need to change.
Right. Yeah, that's kind of what we're anticipating. If there's any things that they come up with during the review, we'll change that in the final copy so that it is IRB approved when it gets out. But that's kind of what we're thinking as well. Christine asks, what if we don't break our date down by age group? I think it's what if we don't break our data down by age group?
Well, then you will determine if you say, oh, we're just going to do all electronic. And that's fine. You can do that. Just know that if the majority of your guest population age is older, then surveys tell us that they're probably not going to complete your survey electronically. And vice versa. If your majority of your age population is younger, then they're probably not going to complete your survey on paper. So it really is to your advantage just to kind of go through your database and figure that out. And like Janice did it at the SECU house, I think she divided it so that she knew this age population was going to get an electronic link and this age population was going to get a paper survey. It's very smart to do it that way, but you can certainly, and you can choose to do it all paper. It's really just your call. I've done it all paper for 10 years. I'm happy with the paper. We've trained volunteers how to input the data, but it's totally your call. What we're looking for is a high rate of participation from our houses, and we're talking like 80% of our membership is what we'd like to see participate in the survey, and it's to your advantage, of course, to participate to get your data. So.
And then Janice asks, I don't know if I missed this, but what format will the reports be coming back to us? The pilot results were hard to use.
I don't have that specifically from OSU yet into what format, but I would expect you're going to get something back that you actually can manipulate the data or change filters or that kind of thing. I kind of expect it'll be in, it's not Excel, but it'll be something like that, that's usable. And then you'll have probably some PDFs. But once we get a little further down the road with OSU, I'll get that back to you.
And then she asks, I'm assuming we will exclude families where the patient died, correct?
Not necessarily. Not necessarily. I think if you want to pull that population out, I think you could still survey them. You may want to put a sticky note or an additional note on their cover letter with some condolence message, but I'm not sure I would rule them out. You wouldn't send it to the patient. That's what I'm saying. You would send it to the caregiver of the patient if you identified that situation with your guest.
And then Janice asked to follow up. The pilot used the time period July 1, 2017 to June 30, 2018. So this next survey timeframe should be July 1, 2018 to June 30, 2019, or we will be resurveying people.
I'm sorry. We'll whatever timeline is picked, we won't be resurveying people at all. So it will be either or. It'll be either 2018 January to December, or it'll be July 1st, 2018 through June 30th, 2019. So as soon as I get that from the professors, I'll let you know. But no, there won't be an overlap. It'll be, that's the date, that's the ones we pick, and that's the one we go with.
And then Mona asks, will you be able to give us a progress update on return rate of our specific houses? And I wasn't intentionally skipping anybody's questions. I was trying to kind of bundle questions from one person all together. So I apologize that I missed that.
Yes, we should be able to do that based on the questions that they answer, because it's by the house. So when those paper surveys come in, it will have your house name on it, and you'll know how many you sent out, and so we'll need you to report those numbers actually. So you'll get an email from us along the way that says how many surveys did you send out, and that'll be your base number. And then as the surveys come in, either electronically or paper, we'll be able to account against that number.
Right, and it'll be helpful for us because we are doing it on, that if you participate in the survey, you're going to be able to get the final report for free. So it's helpful to us here at the national office as we start to compile that participant list, that you let us know that you are participating, that you have sent out the link, how many people you surveyed it to, or that you mailed it out, and that way we can start to track that for you in terms of the rate of return. I know some of our provisional members are going to be participating in the survey, which is great because they're providing interim services while they're in development, but maybe they're only, surveying 10, 15 people, and so it's hard for us to know without knowing how many people you sent it out to, kind of what the rate of return is. So the more communication we get from our members, the more helpful it is for us as we're tracking that, and we're going to be building our participant list.
And if one more thing, I think after you send out the initial paper surveys, we're actually going to get the returned paper surveys with bad addresses. We're actually going to get those in Tulsa, I think. No?
I think it'll go back to the one on the outside.
Okay, so maybe it's going to go back to you. It is. It's going to go back to you. So you'll know how many of your original surveys didn't make it through, and then you also need to somehow check your email bounce backs to know how many of those didn't make it through. So we'll have some kind of email that goes out, probably 30 days out or something that asks you those questions of how many surveys will return to you.
And then Janice asked, if we do January to December, back to the timeline, the houses that participated in the last in the pilot will have 6 months overlap.
Oh,
So
I
think
see what you're
that,
saying. I'm sorry, this was Janice. I'm sorry, Janice. I see what you're saying. We may,
yeah.
yeah, we may adjust your, for the pilot houses, we can adjust your time frame of your houses so that you don't have an overlap.
Okay, and then Janice had a specific question about, Janice, I'll send you the updated survey because we did it, she's asking basically, the question in the survey that asks the subject to rank is not explained clearly on the paper survey, and we got results where people ranked 3 items as number 1, which in the online version you can't do. So when we start to develop, when we finalize the paper survey, you know, we'll be sure to send that out and make sure we're not making those kind of errors on the paper survey.
Yeah, and really, Janice, that's just it's just a way you format the answers to that question so that they can't pick, you know, the same thing twice. It'll be a little bit more clearer on the new revised one.
Yeah, we've taken a lot of the notes from that pilot committee, so we will try to be really diligent when we're reviewing the paper. We know people want to have that PDF be really easy to use and like Tony said, easy to read and formatted in a way that makes sense. So we'll try to be very, very diligent when we create that final PDF. The only holdup, like we said, is just that we want to make sure when we build the PDF, we're using those final approved questions, because if there are any changes that tend to be very small and it's not worth it for us to try to do something so detailed and then have it change at the last minute.
Right.
I think I was scrolling back through. I don't think I missed anybody else's questions, but feel free again to use the chat if I did miss one. Got a bunch here and I was trying to filter through ones that we already answered. So if I missed your question, please let me know in the chat. And Kathy says, lots of good work. It's very exciting. Thanks to all of you.
Thank you. Appreciate that.
My save the date for next month's Ask the Expert is blank because we were confirming it, but it is next month will be on bed bugs. So I will have the updated session information on our website very soon, but that is all confirmed. So we're ready to go, and we have the majority of our summer calendar pretty confirmed, which is very exciting. Our Ask the Expert committee is now expanded, so we have some other people that'll be joining on with us. So we're really excited about the upcoming webinars that we have scheduled for everybody. But yeah, if there's no other questions, I think, Tony, we got to everybody.
Okay, I just want to encourage you, if you do have questions later, would you please email those to Brittany first before you send them to me? And the reason why is because she's going to tabulate or keep track of all those Q&As that we have, and we'll probably just put them on a master Q&A document, and then we'll answer each one and then send that back out to everybody. So I think that will help all of us with time management.
Definitely. We'll have a FAQ section, and I would just encourage everybody, once the program is live, the email will go out, so you'll be notified. But just know that all of the information that's been referenced today in terms of links, sample cover letters, links to the PDFs, tutorial videos, all of that is on our website. We're putting it all in one place. So you'll be able to go to our website, go to member resources, and click the National Hospitality Impact Study. You won't even need to log in to see everything, so you don't need to worry about trying to track down your password. It's all going to be there, and so like Tony said, we'll tabulate also the FAQs there as well, and then we'll pop up this orientation video as well. So really, we will try to have everything there so that it's as easy for you guys to find this as possible. Yeah, Tony, anything else?
I don't think so. I can't thank you guys enough, though, for your help and support. And really, a big thank you to the national office, to Brittany and Cole, and Kristen for all their support and helping us get this far with this. This is not a one-woman thing. This took a whole team of people, both from the pilot houses, OSU, and our great staff at HHN. So Brittany, Cole, Kristen, thank you so much for all your support.
Well, thank you, Tony, for getting us through today and for being a part of this, reading this for, like she said, years and years. So it's very, very exciting that we're as close as we are. So like I said, we'll be sending out the email once everything is live. But thank you, everybody, for joining us on today's webinar. And hopefully we answered everybody's questions, and you'll all be ready to participate in July when it goes live. All right, Tony, thank you.
Goodbye, everybody. Have a great day.
Bye-bye.